Question 1. The risk matrix shows a moderate probability of a serious vascular event if a patient's reported symptoms are not thoroughly investigated. Yet the patient, who is experiencing symptoms suggestive of peripheral artery disease exacerbation, strongly prefers to continue their vascular care exclusively via telemedicine due to mobility issues and convenience. As a certified vascular specialist, what is the most ethically and professionally responsible course of action? Option A. Advise the patient to seek care from a different provider who may be more amenable to exclusively telemedicine-based vascular care. Option B. Continue with telemedicine consultations, trusting the patient's judgment regarding their ability to manage their condition remotely and their preference for convenience. Option C. Recommend and facilitate an in-person vascular assessment, explaining the clinical necessity and exploring options to mitigate the patient's mobility challenges for the appointment. Option D. Prescribe medication via telemedicine and schedule a follow-up telemedicine appointment in 2 weeks, assuming the symptoms will stabilize. The correct answer is C. Recommend and facilitate an in-person vascular assessment, explaining the clinical necessity and exploring options to mitigate the patient's mobility challenges for the appointment. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in telemedicine, balancing patient access and convenience with the physician's duty of care and the limitations of remote assessment. The challenge lies in determining the appropriate level of intervention when a patient's condition, assessed remotely, raises concerns that might necessitate in-person evaluation, but the patient expresses a strong preference for continued telemedicine. The physician must navigate patient autonomy against professional responsibility, considering the potential for misdiagnosis or delayed treatment if the remote assessment is insufficient. Correct approach analysis. The correct approach prioritizes patient safety and adherence to professional standards of care, which mandate that physician must ensure they can provide adequate care. When a remote assessment suggests a need for further investigation or intervention that cannot be safely or effectively managed via telemedicine, the physician has a professional and ethical obligation to recommend or facilitate an in-person evaluation. This aligns with regulatory frameworks that expect physicians to practice within their scope and to ensure patient well-being, even when utilizing novel technologies like telemedicine. The physician's responsibility is to the patient's health outcome, not solely to the patient's expressed preference for a particular mode of care, if that mode is demonstrably insufficient for the clinical situation. Incorrect approaches analysis. One incorrect approach involves solely relying on the patient's preference for telemedicine, even when the clinical assessment indicates a potential for serious vascular compromise that requires physical examination or diagnostic imaging not available remotely. This fails to uphold the physician's duty of care and could lead to delayed diagnosis and treatment, violating ethical principles of beneficence and non-maleficence. It also potentially contravenes regulatory guidelines that require physicians to ensure the appropriateness of telemedicine for the specific clinical scenario. Another incorrect approach is to dismiss the patient's concerns entirely and insist on an immediate in-person visit, without adequately exploring the patient's reasons for preferring telemedicine or offering alternative remote management strategies if clinically appropriate. An in-person visit may be necessary. A complete dismissal of the patient's perspective can erode trust and lead to noncompliance. However, this is less severe than the first incorrect approach as it still acknowledges the need for a visit, but the communication and patient engagement are suboptimal. A third incorrect approach is to proceed with a telemedicine consultation that is clearly inadequate for the patient's presenting symptoms, perhaps due to limitations in remote diagnostic capabilities or the physician's comfort level with assessing the specific vascular issue remotely. This constitutes practicing below the expected standard of care and exposes the patient to significant risk, violating ethical and regulatory expectations for competent medical practice, regardless of the modality used. Professional reasoning. Professionals should employ a structured decision-making process when faced with such dilemmas. First, thoroughly assess the clinical situation based on available information, considering the limitations of telemedicine. Second, clearly communicate the findings and the rationale for any recommended course of action to the patient, addressing their concerns and preferences. Third, explore all clinically appropriate options, including further telemedicine interventions if feasible and safe, or facilitating an in-person evaluation. Fourth, document the entire process, including the patient's preferences, the physician's recommendations, and the rationale for the chosen course of action. The ultimate decision must prioritize patient safety and the highest achievable standard of care. Question 2. Analysis of the optimal application of magnetic resonance angiography, MRA, for evaluating suspected renovascular hypertension in a patient with a history of moderate renal impairment and a known metallic stent in the renal artery. Which of the following approaches best aligns with established safety protocols and diagnostic best practices for certified vascular specialists? Option A. Prioritize non-contrast MRA techniques, such as time-of-flight TOF, MRA, to assess the renal arteries, and consider a limited, carefully dosed gadolinium injection only if non-contrast sequences are inconclusive and renal function is re-evaluated. Option B. Recommend an alternative imaging modality like computed tomography angiography, CTA, due to the presence of a metallic stent and renal impairment, avoiding MRA altogether. Option C. Perform a standard MRA without contrast, assuming the metallic stent will not significantly impede visualization of the renal artery lumen. Option D. Proceed with a contrast-enhanced MRA, using a standard dose of gadolinium-based contrast agent, as this provides the most detailed visualization of the renal arteries. The correct answer is D. Proceed with a contrast-enhanced MRA using a standard dose of gadolinium-based contrast agent, as this provides the most detailed visualization of the renal arteries. Explanation. Scenario analysis. This scenario presents a common challenge in vascular imaging where the optimal application of magnetic resonance angiography, MRA, requires a nuanced understanding of its principles and limitations, particularly concerning patient safety and diagnostic accuracy. The challenge lies in selecting the most appropriate MRA technique for a specific clinical indication, balancing the need for detailed vascular visualization with potential risks such as gadolinium contrast agent administration and the presence of metallic implants. A thorough understanding of MRA physics, contrast mechanisms, and contraindications is essential for making informed decisions that prioritize patient well-being and diagnostic yield. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's clinical history, including any known vascular pathology, renal function, crucial for contrast excretion, and the presence of any implanted medical devices. This assessment guides the selection of the most suitable MRA sequence and contrast agent, if required. For instance, if evaluating peripheral arterial disease in a patient with normal renal function and no contraindications, a contrast-enhanced MRA using a gadolinium-based contrast agent would be appropriate. If the patient has impaired renal function, non-contrast MRA techniques, such as time-of-flight TOF or phase contrast PC MRA, would be preferred to avoid nephrogenic systemic fibrosis, NSF. Similarly, the presence of certain metallic implants may necessitate specific MRA sequences or alternative imaging modalities. This approach aligns with best professional practice by adhering to established guidelines for safe and effective MRA utilization, emphasizing patient-specific risk stratification and the principle of do no harm. It ensures that the diagnostic information obtained is reliable and that patient safety is paramount, reflecting the ethical obligations of a certified vascular specialist. Incorrect approaches analysis. One incorrect approach would be to routinely administer gadolinium-based contrast agents for all MRA examinations without first assessing the patient's renal function. This poses a significant regulatory and ethical failure, as it increases the risk of NSF in patients with moderate to severe renal impairment, a known complication of gadolinium contrast agents. This violates the principle of patient safety and potentially contravenes guidelines from regulatory bodies that mandate renal function assessment prior to contrast administration. Another incorrect approach would be to dismiss MRA as a viable option solely based on the presence of any metallic implant. While some implants are absolute contraindications, many are now considered MR conditional, meaning they can be safely imaged under specific conditions. Failing to investigate the MR compatibility of the implant and explore MR conditional sequences would be a failure to provide the most appropriate diagnostic imaging, potentially leading to suboptimal patient care and missing critical diagnostic information. This could be considered a breach of professional duty to utilize all available safe and effective diagnostic tools. A third incorrect approach would be to rely solely on the referring physician's request without independently verifying the clinical indication and contraindications for MRA. While the referring physician provides the initial indication, the certified vascular specialist has a responsibility to ensure the safety and appropriateness of the chosen imaging modality. This oversight could lead to ordering an MRA in a patient for whom it is contraindicated or for whom a different modality would be more suitable, representing a failure in independent clinical judgment and adherence to safety protocols. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough review of the patient's medical history and the specific clinical question. This involves identifying potential contraindications to MRA, such as severe renal dysfunction or the presence of Mr. Unsafe implants. Subsequently, the technologist must select the most appropriate MRA technique, considering whether contrast enhancement is necessary and feasible, or if non-contrast techniques are indicated. This decision-making process is guided by institutional protocols, professional society guidelines, e.g., Society of Cardiovascular Magnetic Resonance (SCMR), and regulatory requirements, e.g., FDA guidance on MRI safety and contrast agents. Continuous professional development and staying abreast of advancements in MRA technology and safety are crucial for maintaining competence and providing optimal patient care. Question 3. The monitoring system demonstrates a significant decrease in distal perfusion pressure in the left leg, accompanied by a palpable but diminished dorsalis pedis pulse. The patient reports intermittent claudication that has worsened over the past 3 months, and the skin on the left foot appears cool and slightly pale. Considering the structural and functional characteristics of the arterial system, which of the following diagnostic pathways would be most appropriate to investigate the underlying cause of these findings? Option A. Recommend immediate anticoagulation therapy based on the presence of a diminished pulse and the risk of thrombus formation in the venous system. Option B. Prioritize duplex ultrasound to assess the patency and velocity of blood flow within the major arteries of the left leg, focusing on identifying areas of stenosis or occlusion. Option C. Initiate a comprehensive venous Doppler study to evaluate the competence of the venous valves and rule out deep vein thrombosis as the primary cause of reduced distal perfusion. Option D. Focus on assessing capillary, refill time, and skin temperature gradients across the foot to determine the extent of microvascular compromise. Correct answer is B. Prioritize duplex ultrasound to assess the patency and velocity of blood flow within the major arteries of the left leg, focusing on identifying areas of stenosis or occlusion. Explanation. Scenario analysis. This scenario presents a common challenge in vascular assessment, where a patient exhibits symptoms suggestive of compromised arterial blood flow, but the initial non-invasive findings are not definitively conclusive. The professional must integrate multiple pieces of information, including patient history, physical examination, and diagnostic data, to arrive at the most accurate diagnosis and treatment plan. The challenge lies in interpreting subtle findings and understanding the underlying pathophysiology of vascular disease, particularly the structural and functional differences between arteries, veins, and capillaries, to differentiate between potential causes of the patient's symptoms. Correct approach analysis. The correct approach involves a systematic evaluation that prioritizes understanding the structural and functional integrity of the arterial system. Arteries are designed to withstand high pressure and deliver oxygenated blood to the periphery. Their structure, with thick, muscular, and elastic walls, is crucial for this function. When assessing potential arterial compromise, focusing on factors that directly impact arterial lumen size, wall integrity, and blood flow velocity is paramount. This includes considering the impact of atherosclerosis, thrombus formation, or external compression on arterial function. Regulatory frameworks for vascular specialists emphasize evidence-based practice and patient safety, which necessitates a thorough investigation of the most likely cause of arterial insufficiency symptoms. Incorrect approach is analysis. One incorrect approach would be to solely focus on venous return. While venous insufficiency can cause leg swelling and discomfort, it typically presents with different symptoms and underlying pathophysiology than arterial insufficiency. Veins have thinner walls and valves to prevent backflow, and their primary role is returning deoxygenated blood to the heart. Misinterpreting arterial symptoms as purely venous would lead to delayed or inappropriate treatment, potentially exacerbating the arterial condition and leading to serious complications like limb ischemia. This failure to correctly identify the affected vascular system represents a significant deviation from professional standards and could violate regulations concerning competent practice. Another incorrect approach would be to overlook the role of capillaries. Capillaries are the smallest blood vessels, forming a network between arterioles and venules, and are the primary sites for nutrient and gas exchange. While capillary dysfunction can occur, it is usually a consequence of more significant arterial or venous disease or systemic conditions. Focusing on capillary function in isolation, without first addressing potential macrovascular issues in arteries or veins, would be a misdirection of diagnostic effort and could delay the identification of the root cause of the patient's symptoms. This would represent a failure to apply a hierarchical diagnostic approach, which is often implicitly or explicitly required by professional guidelines. A further incorrect approach would be to dismiss the finding due to a lack of overt, textbook signs of severe arterial occlusion. Vascular disease can present with a spectrum of severity. Early or moderate arterial compromise may not always manifest with dramatic, easily observable signs. A competent vascular specialist must be able to recognize subtle indicators and understand that the absence of severe findings does not equate to the absence of disease. Relying solely on the most obvious clinical presentations, rather than a comprehensive understanding of vascular physiology and pathology, can lead to misdiagnoses and patient harm, which would be a breach of professional duty of care. Professional reasoning. Professionals should approach such scenarios by first identifying the primary vascular system implicated by the patient's symptoms and initial findings. This involves a thorough understanding of the distinct structures and functions of arteries, veins, and capillaries. A systematic diagnostic pathway should then be employed, starting with the most likely cause based on the clinical presentation. This often involves non-invasive vascular studies to assess blood flow, vessel patency, and wall characteristics. If initial findings are equivocal, further investigation, potentially including more advanced imaging or functional tests, should be considered. Throughout this process, adherence to established clinical guidelines and ethical principles of patient care, including accurate diagnosis and timely intervention, is paramount. Question 4. Stakeholder feedback indicates a need to refine the process for ankle brachial index ABI assessment to improve diagnostic consistency. Considering the certified vascular specialist exams focus on regulatory frameworks and best practices, which of the following approaches best addresses this feedback regarding ABI methodology and interpretation? Option A. Standardizing cuff sizes based on patient height rather than limb circumference, and interpreting borderline ABI values as normal to avoid unnecessary further investigations. Option B. Implementing a mandatory peer review process for all ABI reports, focusing on the correlation between the calculated ABI and the documented Doppler waveforms, and ensuring that any deviations from standard interpretation are clearly justified with supporting clinical evidence. Option C. Encouraging practitioners to develop their own preferred methods for ABI measurement and interpretation based on anecdotal experience, as long as they achieve a high perceived success rate in their individual practice. Option D. Relying primarily on automated ABI devices that provide a digital readout, assuming that the technology inherently guarantees accurate and interpretable results without the need for manual verification or consideration of waveform morphology. The correct answer is B. Implementing a mandatory peer review process for all ABI reports, focusing on the correlation between the calculated ABI and the documented Doppler waveforms, and ensuring that any deviations from standard interpretation are clearly justified with supporting clinical evidence. Explanation. Scenario analysis. This scenario presents a common challenge in vascular assessment, ensuring consistent and accurate ankle brachial index (ABI) measurements across different clinical settings and practitioners. Stakeholder feedback highlights a potential gap in standardized technique and interpretation, which can lead to misdiagnosis, inappropriate treatment decisions, and ultimately suboptimal patient outcomes. The professional challenge lies in bridging this gap by reinforcing best practices and ensuring adherence to established guidelines, particularly when dealing with patients who may have confounding factors affecting ABI readings. Correct approach analysis. The correct approach emphasizes a systematic and evidence-based methodology for ABI measurement and interpretation, directly aligning with the principles of the Certified Vascular Specialist certification. This involves meticulous patient preparation, precise cuff selection and placement, accurate Doppler signal acquisition, and a thorough understanding of normal and abnormal ABI values, as well as factors that can influence results, e.g., calcified arteries. Adherence to established protocols, such as those outlined by relevant professional vascular societies and regulatory bodies governing diagnostic imaging and patient care, is paramount. This ensures reproducibility, accuracy, and comparability of results, forming the foundation for sound clinical decision-making and appropriate patient management. Incorrect approach is analysis. One incorrect approach involves relying solely on a single ABI measurement without considering potential confounding factors, or repeating the measurement if initial results are equivocal. This fails to meet the standard of care by not accounting for physiological variability or technical errors, potentially leading to a false positive or negative diagnosis. Ethically, it compromises patient well-being by not ensuring the most accurate assessment possible. Another incorrect approach is to interpret ABI results without a comprehensive understanding of the patient's clinical presentation and other diagnostic findings. This siloed interpretation can lead to misdiagnosis, as ABI is just one piece of the diagnostic puzzle. Regulatory failure occurs if the interpretation deviates from established diagnostic pathways that integrate multiple data points for a holistic patient assessment. A third incorrect approach is to use non-standardized equipment or techniques for ABI measurement. This directly violates guidelines for diagnostic accuracy and reproducibility. It introduces significant variability and unreliability into the data, making it impossible to compare with established reference ranges or to confidently guide treatment. This represents a failure to adhere to professional standards and potentially regulatory requirements for quality assurance in diagnostic procedures. Professional reasoning. Professionals should approach ABI assessment with a commitment to continuous learning and adherence to established protocols. This involves 1. Thoroughly reviewing patient history and physical examination findings to identify potential confounding factors. 2. Employing standardized measurement techniques, including appropriate cuff size and placement, and ensuring adequate Doppler signal quality. 3. Interpreting ABI results within the context of the patient's overall clinical picture, considering other diagnostic modalities. 4. Recognizing the limitations of ABI and knowing when further investigation or alternative diagnostic methods are warranted. 5. Regularly reviewing and updating knowledge of current guidelines and best practices from reputable vascular organizations. Question 5. Research into the neurovascular anatomy of a patient reveals a significant hypoplasia of the dominant left vertebral artery and a fenestration of the basilar artery. The patient presents with transient ischemic attacks, TIA, suggestive of posterior circulation ischemia. Considering these findings, what is the most appropriate next step in management? Option A. Proceed directly to endovascular intervention to address the basilar artery fenestration, assuming it is the primary cause of TIAs. Option B. Recommend surgical bypass of the hypoplastic vertebral artery to improve flow to the posterior circulation. Option C. Disregard the anatomical findings as incidental and focus solely on managing the patient's risk factors for stroke. Option D. Initiate antiplatelet therapy and closely monitor for further neurological events, while considering anticoagulation if indicated by embolic sources. The correct answer is D. Initiate antiplatelet therapy and closely monitor for further neurological events, while considering anticoagulation if indicated by embolic sources. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified vascular specialist to integrate complex neurovascular anatomical knowledge with critical patient care decisions under time pressure. Misinterpreting the anatomical nuances of the posterior circulation can lead to delayed or incorrect treatment, potentially resulting in severe neurological deficits or death. The specialist must not only identify the anatomical abnormality, but also accurately predict its hemodynamic significance and potential for complications, such as embolization or rupture. Correct approach analysis. The correct approach involves a thorough understanding of the vertebrobasilar system's anatomy, including variations in the origin and course of the vertebral arteries, the basilar arteries formation, and the collateral supply from the circle of Willis. This knowledge allows for the accurate identification of the specific anatomical variant, e.g., hypoplastic vertebral artery fenestrated basilar artery, and its potential implications for blood flow and stroke risk. Best professional practice dictates a systematic evaluation of the imaging findings in conjunction with the patient's clinical presentation, leading to a tailored management plan that prioritizes patient safety and optimal outcomes. This aligns with the ethical obligation to provide competent and evidence-based care, as expected within the regulatory framework governing vascular specialists. Incorrect approach is analysis. One incorrect approach would be to dismiss the anatomical finding as incidental without considering its potential hemodynamic impact. This fails to meet the standard of care by neglecting a potentially significant risk factor for cerebrovascular events, violating the duty to thoroughly assess all relevant findings. Another incorrect approach would be to recommend an aggressive intervention based solely on the presence of an anatomical variant, without a comprehensive assessment of the patient's overall risk profile and the specific implications of the variant. This could lead to unnecessary procedures and associated complications, contravening the principle of do no harm and potentially violating guidelines on appropriate use of interventions. A third incorrect approach would be to rely on generalized anatomical knowledge without specific consideration of the detailed imaging findings. This demonstrates a lack of diligence and can lead to misdiagnosis or underestimation of risk, falling short of the expected level of expertise and potentially breaching professional standards. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a meticulous review of all diagnostic imaging, correlating it with the patient's history and physical examination. This should be followed by an in-depth analysis of the identified neurovascular anatomy, considering its potential functional significance and associated risks. Consultation with colleagues or further specialized imaging may be warranted if the findings are complex or uncertain. The ultimate management plan should be individualized, evidence-based, and clearly communicated to the patient and referring physician, ensuring all decisions are ethically sound and compliant with regulatory requirements. Question 6. Compliance review shows a certified vascular specialist is evaluating a patient presenting with bilateral leg swelling, skin discoloration, and occasional aching. The specialist must determine the most appropriate diagnostic and management strategy. Which of the following approaches best reflects the required standard of care for diagnosing and managing venous insufficiency? Option A. Attribute the venous insufficiency symptoms solely to the patient's sedentary lifestyle and recommend increased physical activity without further diagnostic investigation. Option B. Prioritize identifying the primary cause of venous insufficiency, such as valvular incompetence or venous obstruction, and then assess and manage the resulting consequences like edema and skin changes. Option C. Focus primarily on managing the visible consequences of venous insufficiency, such as edema and skin discoloration, with compression therapy and topical treatments. Option D. Rely on the patient's description of their symptoms and their self-diagnosis of venous insufficiency to initiate treatment. The correct answer is B. Prioritize identifying the primary cause of venous insufficiency, such as valvular incompetence or venous obstruction, and then assess and manage the resulting consequences like edema and skin changes. Explanation. Scenario analysis. This scenario presents a common challenge in vascular practice, differentiating between the primary causes of venous insufficiency and secondary complications. Patients often present with symptoms that can be attributed to multiple underlying factors, requiring a thorough and systematic diagnostic approach. Misinterpreting the root cause can lead to ineffective treatment, patient dissatisfaction, and potential adverse outcomes, highlighting the need for precise clinical judgment and adherence to established diagnostic pathways. Correct approach analysis. The correct approach involves a systematic evaluation that begins with identifying the primary cause of venous insufficiency, such as valvular incompetence or venous obstruction. This is followed by assessing the consequences of this primary issue, which can manifest as skin changes, edema, or ulceration. This method aligns with best professional practice by addressing the fundamental pathology first, ensuring that treatment targets the source of the problem. Regulatory frameworks for vascular specialists emphasize evidence-based diagnosis and treatment, prioritizing interventions that directly address the identified cause of venous insufficiency. This approach ensures patient safety and optimizes treatment efficacy by preventing the management of symptoms without resolving the underlying condition. Incorrect approach is analysis. focusing solely on the visible consequences, such as edema or skin discoloration, without investigating the underlying cause of venous insufficiency, represents a significant regulatory and ethical failure. This approach neglects the fundamental principle of diagnosing and treating the root pathology, potentially leading to ineffective or even harmful interventions. It fails to meet the standard of care expected of a certified vascular specialist, which mandates a comprehensive diagnostic process. Attributing venous insufficiency solely to lifestyle factors without a thorough medical workup is another failure. A lifestyle can contribute, it is rarely the sole cause of significant venous insufficiency. This approach bypasses essential diagnostic steps, such as venous duplex ultrasound, which are crucial for identifying structural or functional abnormalities. This oversight can lead to misdiagnoses of more serious underlying conditions, violating ethical obligations to provide thorough patient care, and potentially contravening regulatory requirements for diagnostic accuracy. Treating venous insufficiency based on patient self-diagnosis or anecdotal evidence without a formal clinical assessment and diagnostic testing is professionally unacceptable. This approach disregards the expertise and established protocols required for accurate diagnosis and treatment planning. It poses a direct risk to patient safety by potentially leading to inappropriate treatments and delaying effective management, which is a clear breach of professional responsibility and regulatory expectations for qualified medical practitioners. Professional reasoning. Professionals should approach venous insufficiency by first establishing a comprehensive patient history and performing a thorough physical examination. This should be followed by appropriate diagnostic imaging, typically venous duplex ultrasound, to identify the specific cause, e.g., superficial venous reflux, deep venous obstruction, perforator incompetence. Once the cause is identified, the consequences, e.g., edema, skin changes, ulceration, can be assessed and managed in conjunction with treating the underlying pathology. This systematic, evidence-based approach ensures that patient care is safe, effective, and compliant with professional standards and regulatory guidelines. Question 7. Strategic planning requires a certified vascular specialist to evaluate the integration of a new, advanced ultrasound system into their practice. Considering the principles of ultrasound physics and their application in vascular imaging, which approach best ensures the responsible and effective adoption of this technology to enhance diagnostic capabilities while maintaining patient safety and diagnostic accuracy? Option A. Utilize the new ultrasound system for research purposes only, without integrating it into routine patient care, until its long-term benefits and potential drawbacks are fully understood through extensive peer-reviewed literature. Option B. Prioritize the acquisition of the new ultrasound system based on its marketing claims and integrate it into the workflow as quickly as possible to gain a competitive advantage, deferring extensive staff training until operational issues arise. Option C. Conduct a thorough review of the new ultrasound system's technical specifications and clinical validation studies. Develop a comprehensive in-house training program for all sonographers and interpreting physicians, and implement a phased rollout with rigorous quality assurance checks against established diagnostic benchmarks before full integration. Option D. Immediately deploy the new ultrasound system across all vascular imaging modalities. Relying on vendor-provided basic training and assuming staff will adapt quickly to its advanced features. The correct answer is D. Immediately deploy the new ultrasound system across all vascular imaging modalities. Relying on vendor-provided basic training and assuming staff will adapt quickly to its advanced features. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified vascular specialist, CVS, tasked with implementing new ultrasound technology. The challenge lies in balancing the potential benefits of advanced imaging with the practicalities of staff training, workflow integration, and ensuring patient care remains paramount. A CVS must exercise careful judgment to navigate these complexities, ensuring that technological adoption enhances, rather than compromises, diagnostic accuracy and patient safety. The pressure to adopt new technology quickly can sometimes overshadow the need for thorough evaluation and preparation, creating a tension between innovation and established best practices. Correct approach analysis. The correct approach emphasizes a phased implementation strategy that prioritizes comprehensive staff education and validation of the new technology's performance against established benchmarks. This aligns with the core principles of professional practice for a CVS, which include maintaining the highest standards of diagnostic imaging and patient care. Regulatory frameworks for medical devices and professional practice guidelines for vascular specialists typically mandate that new technologies be thoroughly understood and validated before widespread clinical use. This ensures that the technology is used safely and effectively, leading to accurate diagnoses and appropriate patient management. Ethical considerations also dictate that patients should not be subjected to unproven or inadequately understood diagnostic methods. By focusing on education and validation, the CVS upholds their responsibility to provide competent and evidence-based care, ensuring that the new technology serves as a reliable tool for improving patient outcomes. Incorrect approaches analysis. Adopting the new ultrasound technology without adequate staff training poses a significant risk of misinterpretation of images, leading to incorrect diagnoses and potentially harmful patient management decisions. This failure to ensure competency directly contravenes professional standards and regulatory expectations for qualified practitioners. Implementing the technology without validating its performance against existing diagnostic modalities or established quality metrics means that its actual diagnostic yield and reliability in the specific clinical setting are unknown. This can lead to over-reliance on potentially flawed data or underestimation of pathology, both of which are ethically and professionally unacceptable. Furthermore, introducing new equipment without a clear plan for workflow integration can disrupt patient flow, increase wait times, and reduce overall departmental efficiency, negatively impacting patient experience and access to care. This demonstrates a lack of strategic foresight and a failure to consider the holistic impact of technological adoption. Professional reasoning. Professionals should approach the integration of new technology with a systematic and evidence-based methodology. This involves 1. Thoroughly researching the technology's capabilities and limitations. 2. Developing a comprehensive training program for all relevant staff, ensuring they understand the principles of operation, image acquisition, and interpretation specific to the new system. 3. Establishing clear validation protocols to compare the new technology's performance against existing gold standards or established diagnostic criteria. 4. Planning for seamless workflow integration, considering patient scheduling, equipment maintenance, and data management. 5. Continuously monitoring the technology's performance and its impact on patient outcomes, making adjustments as necessary. This structured approach ensures that technological advancements are adopted responsibly, ethically, and in a manner that maximizes benefits for patient care while adhering to all regulatory and professional requirements. Question 8. Which approach would be most appropriate for a certified vascular specialist when initial non-invasive vascular assessment for suspected peripheral arterial disease yields equivocal results in a symptomatic patient? Option A. Recommend a targeted duplex ultrasound examination of specific arterial segments based on clinical suspicion and initial findings. Option B. Advise the patient that no further investigation is necessary due to the equivocal nature of the initial assessment. Option C. Proceed directly to a computed tomography angiography, CTA, of the lower extremities to obtain definitive anatomical detail. Option D. Rely solely on the patient's subjective report of symptoms without any further objective vascular assessment. The correct answer is A. Recommend a targeted duplex ultrasound examination of specific arterial segments based on clinical suspicion and initial findings. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits symptoms suggestive of peripheral arterial disease, PAD, but the initial non-invasive assessment yields equivocal results. The professional challenge lies in determining the most appropriate next step to accurately diagnose the extent and severity of the vascular condition, ensuring patient safety, and adhering to established clinical guidelines and regulatory expectations for vascular specialist practice. Misinterpretation or delayed diagnosis can lead to suboptimal patient outcomes, including progression of disease, increased risk of limb-threatening ischemia, and potential for unnecessary interventions. Correct approach analysis. The correct approach, which involves a targeted duplex ultrasound to assess specific arterial segments based on clinical suspicion and initial findings, represents best professional practice. This is justified by regulatory frameworks and professional guidelines that emphasize evidence-based practice and the judicious use of diagnostic tools. Duplex ultrasound is a cornerstone of non-invasive vascular assessment, offering both anatomical visualization and hemodynamic information. By focusing the examination on areas indicated by the patient's symptoms and the preliminary assessment, the specialist maximizes diagnostic yield while minimizing patient discomfort and resource utilization. This aligns with the ethical principle of beneficence, ensuring the patient receives the most effective diagnostic pathway. Furthermore, regulatory bodies overseeing healthcare professionals expect adherence to established diagnostic algorithms and the appropriate application of imaging modalities. Incorrect approaches analysis, proceeding directly to a more invasive imaging modality without further non-invasive investigation, such as a computed tomography angiography, CTA, or magnetic resonance angiography, MRA, represents a failure to follow a stepwise diagnostic approach. This can be considered a regulatory and ethical failure because it may expose the patient to unnecessary risks associated with contrast agents, radiation in CTA, or the cost of a more complex procedure when a simpler, less invasive method could have provided the necessary information. It deviates from the principle of least harm and efficient resource allocation, which are often implicitly or explicitly part of professional conduct guidelines. Recommending no further investigation due to the initial equivocal findings would be a significant ethical and regulatory failure. This approach neglects the professional responsibility to investigate concerning symptoms thoroughly. It violates the duty of care owed to the patient and could lead to a missed or delayed diagnosis of significant vascular disease, potentially resulting in severe consequences for the patient's limb salvage and overall health. Professional standards mandate that when symptoms suggest a serious condition, appropriate diagnostic measures must be pursued until a definitive diagnosis or exclusion of the condition is achieved. Relying solely on the patient's subjective report of symptoms without any objective vascular assessment, even if initial non-invasive tests are equivocal, is also professionally unacceptable. While subjective symptoms are crucial, they must be corroborated or further investigated with objective data. This approach fails to meet the standard of care expected of a vascular specialist, which includes utilizing diagnostic tools to confirm or refute clinical suspicions. It represents a departure from evidence-based practice and could lead to misdiagnosis or underestimation of disease severity, thereby failing the patient. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough clinical assessment, including patient history and physical examination. This is followed by the selection of appropriate non-invasive diagnostic tools based on the suspected pathology and the initial findings. If initial non-invasive assessments are equivocal, the framework dictates a reasoned progression to more targeted or advanced investigations, always prioritizing patient safety, diagnostic accuracy, and cost-effectiveness. This iterative process ensures that diagnostic efforts are efficient and aligned with the highest standards of patient care, as expected by regulatory bodies and professional ethics. Question 9. The review process indicates a patient presence with symptomatic superficial venous insufficiency, characterized by visible varicose veins, edema, and skin changes. As a certified vascular specialist, what is the most appropriate course of action to address the etiology and clinical implications of these varicose veins, ensuring adherence to regulatory requirements for patient care and documentation? Option A. Proceed directly to endovenous ablation of the most prominent varicose veins based on visual inspection, without a detailed hemodynamic assessment, and record the procedure in the patient's medical record. Option B. Refer the patient to a dermatologist for management of the skin changes, without investigating the underlying venous cause of the varicose veins, and document the referral. Option C. Prescribe compression stockings as the primary treatment, assuming they will manage the symptoms of varicose veins without further diagnostic investigation, and document this prescription in the patient's chart. Option D. Conduct a comprehensive venous assessment, including duplex ultrasound, to identify the underlying hemodynamic abnormalities and determine the specific etiology of the varicose veins. Then develop an individualized treatment plan based on evidence-based guidelines and the patient's clinical implications, with thorough documentation. The correct answer is D. Conduct a comprehensive venous assessment, including duplex ultrasound, to identify the underlying hemodynamic abnormalities and determine the specific etiology of the varicose veins, then develop an individualized treatment plan based on evidence-based guidelines and the patient's clinical implications, with thorough documentation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified vascular specialist to interpret complex clinical findings related to varicose veins, specifically their etiology and clinical implications, within the strict confines of regulatory guidelines for patient care and documentation. The challenge lies in accurately diagnosing the underlying cause of the varicose veins, and then translating that diagnosis into appropriate, evidence-based clinical management, while ensuring all actions are compliant with the established regulatory framework for vascular specialists. Misinterpretation or inadequate documentation can lead to suboptimal patient outcomes, regulatory scrutiny, and ethical breaches. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's history, physical examination findings, and potentially diagnostic imaging to determine the specific etiology of the varicose veins. This diagnosis then guides the selection of the most appropriate, evidence-based treatment strategy, considering the patient's individual clinical implications such as symptoms, impact on quality of life, and risk of complications. Adherence to established clinical guidelines and meticulous documentation of the diagnostic process and treatment plan are paramount. This aligns with the regulatory expectation for competent and ethical practice, ensuring patient safety and quality of care. Incorrect approaches analysis. One incorrect approach would be to recommend a treatment solely based on the superficial appearance of the varicose veins, without a thorough investigation into the underlying venous hemodynamics and etiology. This fails to address the root cause, potentially leading to recurrence or complications, and violates the principle of providing evidence-based care as mandated by regulatory standards. Another incorrect approach would be to document the findings and treatment plan inadequately, omitting crucial details about the diagnostic process or the rationale for the chosen intervention. This lack of thorough documentation is a direct violation of regulatory requirements for medical records, hindering continuity of care and potentially exposing the specialist to liability. A third incorrect approach would be to offer a treatment that is not supported by current clinical evidence or is considered experimental without proper informed consent and adherence to research protocols. If applicable, this disregards the established guidelines and ethical obligations to provide safe and effective care, which are foundational to regulatory compliance. Professional reasoning. Professionals should approach such cases by first systematically gathering all relevant patient information. This includes a detailed history of symptoms, risk factors, and previous treatments. A thorough physical examination, including assessment of venous reflux and obstruction, is essential. If indicated, appropriate diagnostic imaging, such as duplex ultrasound, should be performed to confirm the etiology. Based on this comprehensive assessment, the specialist must then formulate a treatment plan that is aligned with current evidence-based guidelines and tailored to the individual patient's clinical implications. All findings, diagnostic steps, and treatment decisions must be meticulously documented in the patient's medical record, adhering to all applicable regulatory and ethical standards. Question 10. The analysis reveals that a 72-year-old male with a history of diabetes and hypertension presents with intermittent claudication in both lower extremities, limiting his daily activities. His baseline serum creatinine is 1.5 mg/dl. The vascular specialist is considering diagnostic imaging to assess the extent and severity of his peripheral arterial disease. Which of the following approaches best balances diagnostic accuracy with patient safety and resource utilization in this scenario? Option A. Schedule a CT angiography with intravenous contrast to provide a comprehensive vascular map of the lower extremities. Option B. Immediate referral for contrast angiography to obtain definitive anatomical detail for potential intervention. Option C. Proceed with duplex ultrasound to assess arterial patency and identify significant stenoses, reserving contrast angiography for cases where ultrasound is inconclusive or intervention is clearly indicated. Option D. Initiate empiric treatment for peripheral arterial disease based on clinical symptoms alone without further imaging. The correct answer is B. Immediate referral for contrast angiography to obtain definitive anatomical detail for potential intervention. Explanation. Scenario analysis. This scenario presents a professional challenge in selecting the most appropriate imaging modality for a patient with suspected peripheral arterial disease, balancing diagnostic efficacy with patient safety and resource utilization. The challenge lies in discerning the nuanced indications and contraindications of contrast angiography versus alternative imaging techniques, particularly in the context of potential renal compromise and the need for timely intervention. Careful judgment is required to avoid unnecessary invasive procedures while ensuring accurate diagnosis for effective treatment planning. Correct approach analysis. The correct approach involves a thorough assessment of the patient's clinical presentation, risk factors, and renal function to determine the optimal diagnostic pathway. Contrast angiography, while definitive, carries inherent risks, including contrast-induced nephropathy, allergic reactions, and access site complications. Therefore, its indication must be carefully weighed against less invasive alternatives like duplex ultrasound or CT angiography, especially in patients with impaired renal function or those who are not immediate candidates for intervention. The decision to proceed with contrast angiography should be guided by established clinical guidelines and a comprehensive risk-benefit analysis, prioritizing patient well-being and adherence to best practices in vascular imaging. This aligns with the ethical imperative to provide appropriate and safe care, minimizing harm. Incorrect approaches analysis. Proceeding with contrast angiography without a thorough pre-procedure assessment of renal function and a clear indication for intervention represents a failure to adhere to patient safety protocols and potentially violates the principle of non-maleficence. This approach could lead to contrast-induced nephropathy, exacerbating existing renal impairment and necessitating further medical management. Opting solely for duplex ultrasound without considering its limitations in visualizing distal or heavily calcified lesions, or in cases where a comprehensive arterial map is required for surgical planning, may lead to an incomplete diagnosis. This could result in delayed or inappropriate treatment, failing to meet the standard of care for diagnosing significant peripheral arterial disease. Choosing CT angiography without considering the cumulative radiation dose and the potential for contrast-induced nephropathy in a patient with borderline renal function, especially if the information gained is not significantly superior to other modalities for the specific clinical question, would also be an inappropriate approach. This overlooks the principle of judicious use of resources and minimizing patient exposure to potential harms. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive clinical evaluation. This includes a detailed history, physical examination, and review of relevant laboratory data, particularly renal function tests. The next step involves considering the diagnostic capabilities and limitations of various imaging modalities in relation to the specific clinical question. A risk-benefit analysis for each modality, taking into account patient-specific factors such as comorbidities, allergies, and renal status, is crucial. Consultation with interventional radiologists or vascular surgeons may be beneficial in complex cases. The final decision should be documented, clearly outlining the rationale for the chosen diagnostic pathway and any alternatives considered. This process ensures that patient care is individualized, evidence-based, and ethically sound, adhering to the highest standards of professional practice. Question 11. The monitoring system demonstrates a 68-year-old male patient presenting with unilateral leg swelling, pain, and warmth. His medical history includes a recent hip fracture, prolonged immobility, and a diagnosis of congestive heart failure. He is currently taking a diuretic for his heart failure. Which of the following represents the most appropriate initial management strategy to assess for deep vein thrombosis, DVT? Option A. Initiate empiric anticoagulation therapy immediately due to the presence of multiple significant risk factors for DVT. Option B. Advise the patient to increase his physical activity and elevate his leg, deferring further diagnostic workup unless symptoms worsen significantly. Option C. Perform a comprehensive clinical assessment including a DVT risk stratification score and consider compression ultrasonography of the affected limb. Option D. Order a D-dimer assay as the primary diagnostic test to rule out DVT given his age and comorbidities. The correct answer is A. Initiate empiric anticoagulation therapy immediately due to the presence of multiple significant risk factors for DVT. Explanation. This scenario presents a common yet critical challenge in vascular care, identifying and managing deep vein thrombosis, DVT, in a patient with multiple risk factors. The professional challenge lies in synthesizing clinical presentation, patient history, and diagnostic findings to accurately assess DVT risk and initiate appropriate management, balancing the need for timely intervention with the risks of unnecessary anticoagulation. Careful judgment is required to avoid both underdiagnosis, leading to potential pulmonary embolism, P, and post-thrombotic syndrome, and overdiagnosis, resulting in bleeding complications from inappropriate anticoagulation. Correct approach, which involves a comprehensive assessment of the patient's risk factors and clinical signs, followed by targeted diagnostic testing, represents best professional practice. This aligns with established clinical guidelines and regulatory frameworks that emphasize evidence-based medicine and patient safety. Specifically, it adheres to principles of prudent medical practice by avoiding premature assumptions and instead employing a systematic diagnostic pathway. This approach minimizes unnecessary interventions and ensures that treatment is initiated only when supported by objective evidence, thereby upholding the ethical duty to provide competent and safe care. Incorrect approaches fail to adhere to these principles. One incorrect approach might involve immediate anticoagulation based solely on a single risk factor without further investigation. This is professionally unacceptable as it bypasses the diagnostic process, potentially leading to iatrogenic bleeding in a patient who may not have a DVT, violating the principle of do no harm. Another incorrect approach could be to dismiss the patient's symptoms due to the absence of a classic presentation, delaying diagnosis and increasing the risk of complications like PE. This demonstrates a failure in clinical vigilance and adherence to the standard of care, which mandates thorough evaluation of all presenting symptoms suggestive of DVT. A third incorrect approach might be to rely solely on a single diagnostic modality without considering the full clinical picture, potentially leading to misinterpretation of results and inappropriate management decisions. The professional decision-making process for similar situations should involve a structured approach. First, a thorough patient history and physical examination to identify potential risk factors and signs of DVT. Second, application of validated risk stratification tools, e.g., WELL score for DVT to guide further investigation. Third, judicious use of diagnostic imaging such as compression ultrasonography based on the assessed risk. Finally, initiation of appropriate management based on confirmed diagnosis with ongoing monitoring and reassessment. This systematic process ensures that clinical decisions are evidence-based, patient-centered, and aligned with regulatory and ethical standards for vascular care. Question 12. The evaluation methodology shows a 68-year-old male with a history of hypertension and hyperlipidemia presenting with intermittent claudication in his left calf, worsening over the past 6 months. Physical examination reveals diminished pulses in the left lower extremity and a bruit over the left superficial femoral artery. Considering the need for accurate diagnosis and appropriate management, which of the following diagnostic imaging techniques should be the initial modality of choice? Option A, duplex ultrasound of the lower extremities. Option B, angiography via catheter-based intervention. Option C, computed tomography angiography CTA of the lower extremities. Option D, magnetic resonance angiography MRA of the lower extremities. The correct answer is A, duplex ultrasound of the lower extremities. Explanation. The evaluation methodology shows a patient presenting with symptoms suggestive of peripheral arterial disease. The challenge lies in selecting the most appropriate diagnostic imaging technique, balancing diagnostic accuracy, patient safety, and resource utilization, all within the regulatory framework governing vascular specialist practice. This requires a thorough understanding of the capabilities and limitations of various imaging modalities and their adherence to established clinical guidelines and professional standards. The correct approach involves utilizing duplex ultrasound as the initial diagnostic tool. This represents best professional practice because duplex ultrasound is a non-invasive, cost-effective, and widely accessible modality that provides excellent anatomical and hemodynamic information, for the assessment of peripheral arterial disease. It is the cornerstone of initial vascular imaging, according to numerous professional society guidelines and regulatory expectations for efficient and effective patient care. Its safety profile, avoiding ionizing radiation and nephrotoxic contrast agents, aligns with the ethical imperative to minimize patient harm. An incorrect approach would be to immediately proceed to computed tomography angiography, CTA, without prior non-invasive assessment. This fails to adhere to the principle of stepwise diagnostic evaluation, leading to unnecessary radiation exposure and potential contrast-induced nephropathy, especially in patients with comorbidities. Regulatory frameworks often emphasize the judicious use of advanced imaging and the avoidance of unnecessary procedures. Another incorrect approach would be to opt for magnetic resonance angiography, MRA, without considering contraindications such as pacemakers or severe renal dysfunction, or without a clear indication that ultrasound has been insufficient. While MRA can be valuable, it is generally more resource-intensive than ultrasound and carries its own set of risks and limitations that must be carefully weighed. Failing to consider these factors represents a deviation from best practice and potentially a breach of professional responsibility to select the safest and most appropriate diagnostic pathway. Finally, choosing to rely solely on physical examination findings without any imaging confirmation for significant arterial disease would be an unacceptable approach. While a thorough physical exam is crucial, it has limitations in quantifying disease severity and extent, which are critical for treatment planning. Regulatory bodies and professional standards mandate objective diagnostic confirmation for significant vascular pathology to ensure appropriate management decisions. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, risk factors, and the diagnostic capabilities of available imaging modalities. This includes prioritizing non-invasive techniques, considering patient-specific factors e.g., renal function, allergies, presence of implants, and adhering to established clinical pathways and guidelines. The goal is to achieve a definitive diagnosis efficiently, safely, and cost-effectively, in compliance with all applicable regulations and ethical principles. Question 13. During the evaluation of a patient with recurrent claudication in the ipsilateral limb previously treated with angioplasty and stenting for superficial femoral artery, SFA disease, which of the following represents the most appropriate next step in determining the need for reintervention? Option A. Proceed directly with repeat angioplasty and stenting of the previously treated segment based on the return of symptoms. Option B. Obtain a comprehensive vascular imaging study, such as duplex ultrasound or CT angiography, to assess the patency of the prior stent, identify any in-stent restenosis or new occlusive disease, and evaluate the runoff. Option C. Schedule the patient for an immediate bypass graft surgery to address the presumed failure of the prior endovascular intervention. Option D. Recommend aggressive medical management including supervised exercise therapy and risk factor modification without further imaging or intervention, as prior stenting should provide long-term patency. Correct answer is A. Proceed directly with repeat angioplasty and stenting of the previously treated segment based on the return of symptoms. Explanation. This scenario presents a common yet complex clinical challenge in vascular medicine, determining the optimal treatment strategy for a patient with peripheral artery disease (PAD) who has undergone a previous angioplasty and stenting procedure. The professional challenge lies in balancing the potential benefits of reintervention against the risks, considering the patient's evolving clinical status, anatomical factors, and the durability of the prior intervention. Careful judgment is required to avoid unnecessary procedures while ensuring the patient receives appropriate care to prevent limb ischemia and maintain quality of life. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation tailored to the individual patient. This involves a thorough review of the prior intervention's success, assessment of current symptoms and their severity, and advanced imaging to characterize the lesion. Adherence to established clinical guidelines for PAD management, such as those from the Society for Vascular Surgery or relevant national bodies, is paramount. These guidelines emphasize a stepwise approach, starting with conservative measures and progressing to intervention only when indicated and when the potential benefits outweigh the risks. Ethical considerations, including informed consent and patient autonomy, are integral to this process, ensuring the patient understands the rationale for any proposed intervention and alternative options. An incorrect approach that involves proceeding directly to repeat angioplasty and stenting without a thorough reevaluation of the indication and lesion characteristics is professionally unacceptable. This bypasses critical diagnostic steps and could lead to an inappropriate intervention, potentially causing harm without clear benefit. Such an approach may violate ethical principles of beneficence and non-maleficence by exposing the patient to procedural risks without a demonstrated need. Furthermore, it could be seen as a failure to adhere to professional standards of care, which mandate a systematic and evidence-driven approach to patient management. Another incorrect approach, such as deferring any further intervention despite worsening symptoms and objective evidence of significant stenosis, could also be professionally problematic. While conservatism is important, ignoring progressive disease that impacts the patient's quality of life or risks limb viability would be a failure to provide timely and appropriate care. This could be construed as a breach of the duty of care, potentially leading to adverse outcomes like limb loss. The professional decision-making process for similar situations should involve a structured approach. 1. Confirm the indication for intervention. Are the patient's symptoms directly attributable to the treated lesion, and are they significantly impacting their quality of life or limb viability? 2. Review prior interventions. Assess the success, complications, and duration of benefit from previous procedures. 3. Perform advanced imaging. Utilize duplex ultrasound, CT angiography, or Mr. angiography to accurately assess the current anatomy, lesion severity, and morphology, and to identify any in-stent restenosis or new lesions. 4. Consider conservative management. Evaluate the role of medical therapy, lifestyle modification, and wound care. 5. Discuss risks and benefits. Engage in shared decision-making with the patient, clearly outlining the potential benefits, risks, and alternatives to any proposed intervention. 6. Adhere to guidelines. Ensure the chosen treatment strategy aligns with current evidence-based clinical practice guidelines. Question 14. The audit findings indicate a trend of delayed identification and management of early signs of vascular access dysfunction in hemodialysis patients. Which of the following approaches best addresses this systemic issue and aligns with best practices for risk assessment in vascular access management? Option A. Prioritizing the management of acute complications over proactive risk assessment, assuming that most early signs of dysfunction will resolve spontaneously. Option B. Relying on individual clinician experience and patient self-reporting to identify potential access issues, intervening only when overt signs of dysfunction or complications are present. Option C. Deferring comprehensive vascular access risk assessments until a patient experiences a significant access-related event to conserve resources for more critical patient needs. Option D. Implementing a standardized, multidisciplinary protocol for regular vascular access surveillance, including objective assessment parameters and clear escalation pathways for identified risks, coupled with ongoing staff education on early detection and management strategies. The correct answer is D. Implementing a standardized, multidisciplinary protocol for regular vascular access surveillance, including objective assessment parameters and clear escalation pathways for identified risks, coupled with ongoing staff education on early detection and management strategies. Explanation. This scenario is professionally challenging because it requires balancing immediate patient needs with long-term access viability and adherence to established protocols. The audit findings highlight a potential systemic issue in how vascular access complications are managed, necessitating a proactive and evidence-based approach to risk mitigation. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment for each patient. This aligns with the principles of patient-centered care and the regulatory expectation for healthcare providers to implement robust quality improvement processes. Specifically, it emphasizes early identification of risk factors, timely intervention, and ongoing monitoring, which are crucial for preventing serious complications such as infection, thrombosis, and stenosis. This proactive strategy minimizes patient morbidity, reduces healthcare costs associated with complications, and ensures the longevity of the vascular access, thereby optimizing dialysis treatment. Adherence to established clinical guidelines and best practices, as mandated by regulatory bodies overseeing dialysis care, is paramount. An incorrect approach that focuses solely on treating overt complications without addressing underlying risk factors fails to meet professional standards. This reactive approach can lead to recurrent issues, increased patient suffering, and potential breaches of care quality. Ethically, it neglects the duty to provide comprehensive care and prevent foreseeable harm. Regulatory failure lies in not implementing a systematic risk management framework, which is often a requirement for accreditation and licensure in dialysis facilities. Another incorrect approach that relies on anecdotal evidence or personal experience rather than established protocols is professionally unacceptable. This introduces variability and subjectivity into patient care, potentially leading to suboptimal outcomes. It disregards the evidence-based foundation of modern medical practice and the regulatory imperative to follow validated guidelines. A third incorrect approach that delays intervention due to resource constraints without a clear plan for timely resolution is also problematic. While resource management is a reality, patient safety and access to care must remain the priority. Prolonged delays in addressing access issues can lead to irreversible damage and compromised treatment efficacy, representing a failure in both ethical and regulatory obligations to provide timely and effective care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's vascular access status, considering all contributing risk factors. This includes a thorough review of the patient's history, physical examination, and diagnostic imaging. Based on this assessment, a personalized management plan should be developed, incorporating evidence-based interventions and regular follow-up. Collaboration with the multidisciplinary team, including nephrologists, vascular surgeons, and dialysis nurses, is essential. Continuous quality improvement initiatives, informed by audit findings and patient outcomes, should be integrated into practice to ensure ongoing excellence in vascular access management. Question 15. The monitoring system demonstrates segmental pressure measurements with a mild gradient between the thigh and calf pressures on the right lower extremity, but the patient reports no claudication symptoms and has a palpable dorsalis pedis pulse. The vascular specialist is considering the significance of this finding. Which of the following approaches best reflects best professional practice in this scenario? Option A. Focus solely on the numerical pressure gradient and recommend immediate intervention to correct the perceived arterial compromise. Option B. Reperform the measurements after ensuring proper patient positioning and cuff inflation, and consider a duplex ultrasound to assess for hemodynamically significant stenosis if the gradient persists. Option C. Conclude that the mild gradient is likely a normal variation given the palpable pulse and absence of symptoms, and proceed with routine follow-up. Option D. Attribute the gradient to venous insufficiency and recommend compression therapy without further arterial assessment. The correct answer is B. Reperform the measurements after ensuring proper patient positioning and cuff inflation, and consider a duplex ultrasound to assess for hemodynamically significant stenosis if the gradient persists. Explanation. Scenario analysis. This scenario presents a common implementation challenge in vascular diagnostics. The professional is faced with interpreting potentially ambiguous segmental pressure measurements, requiring a nuanced understanding of physiological principles and the limitations of the technology. The challenge lies in distinguishing true pathological findings from artifact or normal physiological variations, which directly impacts patient management and treatment decisions. Accurate interpretation is paramount for patient safety and effective care. Correct approach analysis. The correct approach involves a systematic evaluation of the segmental pressure data in conjunction with the patient's clinical presentation and other diagnostic findings. This aligns with best professional practice by ensuring that diagnostic conclusions are not solely based on isolated data points, but are integrated into a comprehensive understanding of the patient's condition. Regulatory frameworks for vascular specialists emphasize the importance of accurate diagnosis and appropriate patient management, which necessitates this holistic approach. Ethical considerations also mandate that practitioners use all available information to make informed decisions that benefit the patient. Incorrect approaches analysis. One incorrect approach involves solely relying on the absolute numerical values of the segmental pressures without considering the waveform morphology or the patient's symptoms. This fails to acknowledge that pressure measurements can be influenced by factors other than arterial disease, such as patient positioning, cuff inflation technique, or even patient anxiety, which can lead to misdiagnosis and inappropriate treatment. This approach could violate regulatory guidelines that require thorough diagnostic evaluation and could be considered ethically negligent if it leads to patient harm. Another incorrect approach is to dismiss any pressure gradient as insignificant without further investigation, even if it falls within a commonly accepted normal range. This overlooks the possibility of early or subtle disease that may not yet manifest as a large pressure drop, but could still be clinically relevant. Regulatory standards often require investigation of any findings that deviate from expected norms, and failing to do so could be a breach of professional duty. Ethically, this approach prioritizes expediency over thoroughness, potentially compromising patient care. A third incorrect approach is to attribute all observed pressure changes solely to peripheral arterial disease without considering other potential causes, such as venous insufficiency or even technical artifact. This oversimplification can lead to misdirected treatment and a failure to address the true underlying pathology. Regulatory bodies expect practitioners to consider differential diagnoses and to employ diagnostic techniques that can differentiate between various vascular conditions. Ethically, this narrow focus can lead to ineffective or even harmful interventions. Professional reasoning. Professionals should approach segmental pressure measurements with a critical mindset, integrating the data with clinical context. This involves 1. Verifying the technical accuracy of the measurement, including cuff size and placement and patient positioning. 2. Analyzing the waveform morphology for signs of damping or other abnormalities. 3. Comparing segmental pressures to each other and to systemic pressures, looking for significant gradients. 4. Correlating findings with the patient's symptoms, medical history, and other diagnostic tests. 5. Documenting all findings and the rationale for interpretation. This systematic process ensures adherence to regulatory standards for diagnostic accuracy and upholds ethical obligations to provide competent and comprehensive patient care. Question 16. Regulatory review indicates that a certified vascular specialist is evaluating a 68-year-old male presenting with intermittent leg pain, described as a tightness that occurs with walking and resolves with rest. He has a history of type 2 diabetes and hypertension. What is the most appropriate initial approach to assessing this patient's condition? Option A. Immediately order a duplex ultrasound of the lower extremities to rule out significant arterial stenosis. Option B. Focus the history and examination on assessing for diabetic neuropathy and its potential contribution to the leg pain. Option C. Conduct a comprehensive patient history focusing on the characteristics of the leg pain, its relationship to activity and associated symptoms, followed by a targeted physical examination of the peripheral vascular system. Option D. Prescribe a trial of pain medication and advise the patient to rest, assuming the symptoms are likely musculoskeletal. The correct answer is C. Conduct a comprehensive patient history focusing on the characteristics of the leg pain, its relationship to activity and associated symptoms, followed by a targeted physical examination of the peripheral vascular system. Explanation. Scenario analysis. This scenario presents a common challenge in vascular assessment, distinguishing between symptoms that are clearly vascular in origin and those that may be due to other systemic or local conditions. The patient's history of intermittent claudication, while suggestive of peripheral artery disease (PAD), is not pathognomonic. The presence of comorbidities like diabetes and hypertension further complicates the picture, as these conditions can independently cause or exacerbate neurological or musculoskeletal symptoms that mimic vascular claudication. A thorough and systematic approach is crucial to avoid misdiagnosis, delayed treatment, or unnecessary interventions. Correct approach analysis. The correct approach emphasizes a comprehensive patient history and a targeted physical examination, integrating findings to form a differential diagnosis. This aligns with the fundamental principles of clinical practice and regulatory expectations for competent medical professionals. Regulatory frameworks, such as those governing medical practice and patient care standards, mandate that healthcare providers gather sufficient information to make informed diagnostic and treatment decisions. A detailed history, including the onset, duration, character, aggravating and alleviating factors of the patient's symptoms, is paramount. This is followed by a focused physical examination that assesses for objective signs of vascular compromise, such as diminished pulses, skin changes, and bruits. The integration of these subjective and objective findings allows for the development of a differential diagnosis, guiding further investigations and management. This systematic process ensures that patient care is evidence-based, safe, and effective, minimizing the risk of diagnostic error and promoting optimal patient outcomes, which is a core ethical and regulatory requirement. Correct approach is analysis, focusing solely on the patient's report of leg pain and immediately ordering advanced vascular imaging without a thorough history and physical examination, represents a failure to adhere to established clinical protocols and regulatory guidelines. This approach is inefficient, potentially exposes the patient to unnecessary radiation or invasive procedures, and risks overlooking other significant diagnoses. It bypasses the critical step of clinical correlation, which is a cornerstone of responsible medical practice. Assuming the leg pain is solely due to diabetes-related neuropathy without exploring other vascular causes is also a significant diagnostic error. While diabetic neuropathy is a common complication, it does not preclude the presence of concurrent PAD, which requires its own specific management. This narrow focus can lead to undertreatment of vascular disease, potentially resulting in limb ischemia and its severe consequences. Regulatory bodies expect practitioners to consider all plausible diagnoses and not prematurely narrow the differential based on a single comorbidity. Relying exclusively on the patient's description of tightness and attributing it to musculoskeletal strain without a systematic vascular assessment is another failure. Musculoskeletal pain can present with various sensations, and without a vascular examination, the possibility of arterial insufficiency remains unaddressed. This oversight can lead to delayed diagnosis and treatment of PAD, potentially resulting in irreversible limb damage. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a detailed, open-ended patient history to elicit all relevant symptoms and their characteristics. This should be followed by a systematic physical examination, including assessment of peripheral pulses, skin integrity, temperature, capillary refill, and auscultation for bruits. The findings from both the history and physical examination should then be synthesized to generate a list of differential diagnoses. Based on this differential, appropriate diagnostic investigation, such as ankle brachial index, ABI, measurements or vascular imaging, should be ordered to confirm or refute specific diagnoses. This iterative process of information gathering, hypothesis generation, and targeted investigation is essential for accurate diagnosis and effective patient management, adhering to professional standards and regulatory mandates. Question 17. Operational review demonstrates that a certified vascular specialist is faced with two patients requiring immediate intervention. Patient A presents with a ruptured abdominal aortic aneurysm, AAA, a life-threatening emergency requiring immediate surgical repair. Patient B has a critical limb ischemia, CLI, due to chronic peripheral artery disease, PAD, which, while serious and potentially limb-threatening, is not immediately life-threatening in the same way as the ruptured AAA. The specialist is the only available surgeon for the next several hours. Which of the following represents the most appropriate course of action for the certified vascular specialist? Option A. Defer the decision to a hospital administrator to ensure equitable resource allocation. Option B. Immediately proceed with surgical intervention for patient A, as the ruptured AAA poses an immediate threat to life. Option C. Attempt to initiate treatment for both patients concurrently, recognizing the severity of both conditions. Option D. Prioritize patient B's critical limb ischemia due to the chronic nature of their condition and the established patient-physician relationship. The correct answer is B. Immediately proceed with surgical intervention for patient A, as the ruptured AAA poses an immediate threat to life. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a vascular specialist is confronted with potentially conflicting patient interests and resource allocation. The challenge lies in balancing the immediate needs of a patient with a severe, acute vascular event against the long-term, albeit less immediately life-threatening, needs of another patient with a chronic, progressive vascular disease. The specialist must navigate this situation with integrity, ensuring that clinical judgment is not unduly influenced by external pressures or personal biases, and that patient care remains paramount and equitable. Correct approach analysis. The correct approach prioritizes the patient with the acute, life-threatening condition. This aligns with the fundamental ethical principle of beneficence, which dictates acting in the best interest of the patient, and the principle of non-maleficence, avoiding harm. In emergency situations, the immediate threat to life or limb takes precedence. This decision is supported by established medical ethics and implicitly by regulatory frameworks that emphasize timely and appropriate care for emergent conditions. The specialist's responsibility is to stabilize the acutely ill patient first, then reassess and manage the chronic condition. Incorrect approaches analysis. One incorrect approach involves prioritizing the patient with the chronic condition solely based on their longer-standing relationship with the specialist or perceived deservingness due to the chronic nature of their illness. This fails to acknowledge the immediate, life-threatening nature of the acute event and violates the principle of prioritizing emergent care. It could be seen as a failure to adhere to professional standards of emergency vascular management. Another incorrect approach is to defer the decision entirely to administrative staff or a committee without direct clinical oversight of the acute situation. A resource allocation may involve administrative input. The initial clinical triage and prioritization of emergent cases must be guided by medical expertise. This abdication of clinical responsibility could lead to delays in critical care and potentially adverse patient outcomes, which would be a breach of professional duty. A third incorrect approach is to attempt to provide equally urgent, but fragmented, care to both patients simultaneously without adequate resources or personnel. This can lead to compromised care for both individuals, increasing the risk of complications and errors. It demonstrates a failure in effective resource management and clinical judgment under pressure, potentially violating standards of care. Professional reasoning. Professionals should employ a structured decision-making process that begins with a rapid assessment of the acuity and severity of each patient's condition. This involves considering the immediate threat to life, limb, or organ function. Next, they should consult available resources and personnel to determine the feasibility of providing optimal care to both patients concurrently or sequentially. If a conflict arises, the principle of prioritizing emergent, life-threatening conditions should guide the decision. Open and transparent communication with both patients, or their surrogates, regarding the rationale for the care plan is crucial, along with a commitment to addressing the needs of the non-emergent patient as soon as possible. This process ensures that decisions are clinically sound, ethically justifiable, and compliant with professional standards. Question 18. Governance review demonstrates that a vascular specialist is considering implementing a modified endovenous laser therapy, EVL, technique for treating superficial venous insufficiency, which involves altering the standard laser energy delivery protocol and using a different fiber type than specified in the manufacturer's instructions for use, IFU. The specialist believes this modification may improve treatment outcomes based on preliminary discussions with colleagues. Which of the following actions best aligns with regulatory compliance and best professional practice for this scenario? Option A. Proceed with the modified EVL technique, documenting the rationale and perceived benefits in the patient's medical record, assuming the core principles of EVL are maintained. Option B. Obtain explicit approval from the relevant regulatory body for the modified EVL technique and ensure the new fiber type is also approved for use in EVL procedures before implementation. Option C. Implement the modified EVL technique immediately, as the specialist has extensive experience and believes it to be safe and effective, prioritizing potential patient benefit over strict adherence to IFU. Option D. Utilize the modified EVL technique, but only after conducting a small, informal pilot study among willing patients to gather initial data on efficacy and safety. The correct answer is A. Proceed with the modified EVL technique, documenting the rationale and perceived benefits in the patient's medical record, assuming the core principles of EVL are maintained. Explanation. This scenario presents a professional challenge due to the need to balance patient safety and efficacy with the evolving regulatory landscape surrounding novel endovenous laser therapy, EVL, techniques. The core of the challenge lies in ensuring that any new or modified EVL approach adheres strictly to established clinical guidelines and regulatory approvals, particularly concerning device usage and patient selection. The certified vascular specialist must exercise careful judgment to avoid introducing unproven or non-compliant methods that could compromise patient outcomes or lead to regulatory scrutiny. The correct approach represents best professional practice because it prioritizes adherence to the manufacturer's instructions for use, IFU, and relevant regulatory body approvals e.g. FDA in the US, MHRA in the UK, TGA in Australia, depending on the specified jurisdiction for the exam. These IFUs and approvals are based on rigorous clinical trials and safety data, ensuring that the device is used within its validated parameters. Following these guidelines is not merely a procedural step, but a fundamental ethical and regulatory obligation to provide safe and effective care. It demonstrates a commitment to evidence-based practice and patient well-being, minimizing risks associated with off-label or unvalidated applications of medical devices. An incorrect approach that involves deviating from the manufacturer's IFU without explicit regulatory approval or robust clinical evidence for the modified technique is professionally unacceptable. This constitutes a failure to adhere to the established standards of care and regulatory frameworks governing medical device use. Such deviations can lead to unpredictable clinical outcomes, increased risk of complications, e.g., thermal injury, nerve damage, incomplete treatment, and potential legal or disciplinary action for violating medical device regulations and professional conduct standards. Another incorrect approach, such as relying solely on anecdotal evidence or peer recommendations without formal validation or regulatory clearance, bypasses the critical safety and efficacy checks mandated by regulatory bodies. This exposes patients to unquantified risks and undermines the integrity of evidence-based medicine. The professional decision-making process for similar situations should involve a systematic evaluation of any proposed EVL technique against established regulatory requirements, manufacturer guidelines, and peer-reviewed scientific literature. Professionals must actively seek out and understand the IFUs for all devices used. When considering modifications or novel applications, a thorough risk-benefit analysis is paramount, and any significant deviations should be supported by robust clinical data and, where applicable, regulatory approval or clearance. Continuous professional development and staying abreast of regulatory updates are crucial for maintaining compliance and ensuring the highest standard of patient care. Question 19. Implementation of a computed tomography (CT) angiography examination for a patient presenting with acute limb ischemia requires careful consideration of the diagnostic pathway. Which of the following approaches best aligns with regulatory requirements and best practices for a certified vascular specialist? Option A. Ordering a CT angiography examination using a generic high-dose protocol to ensure maximum image detail, regardless of the specific vascular segment or patient factors. Option B. Performing the CT angiography without a prior assessment of the patient's renal function or history of contrast allergies, proceeding with standard contrast administration. Option C. Proceeding with a CT angiography protocol optimized for the specific vascular territory involved, ensuring appropriate contrast administration and radiation dose reduction techniques are employed, following established clinical guidelines. Option D. Recommending an alternative, less definitive imaging modality that does not involve contrast or radiation, even if it significantly compromises diagnostic accuracy for acute limb ischemia. The correct answer is C. Proceeding with a CT angiography protocol optimized for the specific vascular territory involved, ensuring appropriate contrast administration and radiation dose reduction techniques are employed, following established clinical guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in vascular imaging, balancing the need for timely and accurate diagnostic information with patient safety and resource utilization. The certified vascular specialist must navigate the complexities of selecting the most appropriate imaging modality, considering the specific clinical question, patient factors, and the established guidelines for computed tomography (CT angiography). The challenge lies in ensuring that the chosen protocol is both clinically effective and adheres to regulatory standards for radiation exposure and contrast administration, while also being cost-effective. Correct approach analysis. The correct approach involves a thorough clinical assessment to determine if CT angiography is indeed the most indicated diagnostic tool for the patient's presentation. This includes evaluating the suspected pathology, the urgency of diagnosis, and potential contraindications to contrast media or radiation. Following this, the specialist must select a CT angiography protocol that is optimized for the specific vascular territory being examined, minimizing radiation dose and contrast volume while maximizing diagnostic image quality. This aligns with regulatory frameworks that emphasize evidence-based practice, patient safety, and the principle of ALARA, as low as reasonably achievable for radiation exposure. Adherence to established protocols, often derived from professional society guidelines and regulatory bodies, ensures consistency, reproducibility, and optimal diagnostic yield, thereby representing best professional practice. Incorrect approaches analysis. One incorrect approach would be to proceed with a standard, non-tailored CT angiography protocol without a specific clinical indication or consideration of patient-specific factors. This could lead to unnecessary radiation exposure and contrast administration, violating the principle of ALARA and potentially exposing the patient to risks without commensurate diagnostic benefit. It also fails to leverage the full diagnostic potential of CT angiography by not optimizing parameters for the suspected pathology. Another incorrect approach would be to opt for a more invasive or less appropriate imaging modality when CT angiography is clearly indicated and would provide superior diagnostic information with acceptable risk. This could involve delaying diagnosis, increasing patient morbidity, or incurring higher costs without a clear clinical justification, failing to meet the standard of care expected of a certified vascular specialist. A third incorrect approach would be to disregard contraindications to contrast media, such as severe renal impairment or known allergies, without appropriate pre-procedural assessment and management. This poses a direct risk to patient safety and violates ethical and regulatory requirements for informed consent and risk mitigation. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive understanding of the patient's clinical presentation and the diagnostic question. This involves critically evaluating the evidence supporting the use of CT angiography for the specific condition. Subsequently, the specialist must consult and apply relevant professional guidelines and regulatory requirements pertaining to CT angiography protocols, radiation safety, and contrast administration. This includes considering patient-specific factors such as renal function, allergies, and pregnancy status. The decision-making process should prioritize patient safety, diagnostic accuracy, and efficient resource utilization, ensuring that the chosen imaging strategy is both clinically appropriate and compliant with all applicable standards. Question 20. Risk assessment procedures indicate a patient presence with a pulsatile mass and a bruit, highly suggestive of a vascular malformation. Imaging reveals a complex network of abnormal vessels with high flow. Considering the potential for hemorrhage and the need for precise management, which of the following diagnostic and management pathways best aligns with current vascular specialty guidelines and ethical patient care principles? Option A. Initiate a course of conservative management with regular clinical follow-up, as many vascular malformations are benign and may resolve spontaneously. Option B. Proceed directly to embolization of the most prominent feeding vessel identified on initial imaging, as high flow suggests an urgent need for intervention. Option C. Schedule immediate surgical excision of the entire affected area, assuming that complete removal is the safest and most definitive approach for all such lesions. Option D. Conduct a comprehensive non-invasive imaging assessment to fully characterize the malformation's nidus, feeders, and drainers, followed by a multidisciplinary team discussion to determine the optimal treatment strategy, which may include observation, embolization, or surgical intervention based on the specific findings and patient factors. The correct answer is B. Proceed directly to embolization of the most prominent feeding vessel identified on initial imaging, as high flow suggests an urgent need for intervention. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent complexity and potential for significant morbidity and mortality associated with vascular malformations, specifically arteriovenous malformations, AVM. The challenge lies in accurately classifying the malformation, understanding its hemodynamic significance, and determining the most appropriate, least invasive, and safest management strategy. Misclassification or an inappropriate treatment approach can lead to catastrophic complications such as hemorrhage, thrombosis, or paradoxical embolism, impacting patient outcomes and potentially leading to legal or ethical repercussions. The need for a multidisciplinary approach and adherence to established guidelines is paramount. Correct approach analysis. The correct approach involves a comprehensive evaluation that integrates clinical presentation, imaging findings, and patient-specific factors to guide management. This aligns with best professional practice as outlined by vascular specialty guidelines, which emphasize a stepwise diagnostic and therapeutic pathway. The focus on non-invasive imaging to characterize the AVM's nidus, feeding vessels, and draining veins, followed by a discussion of risks and benefits of various treatment modalities, including observation, embolization, or surgical intervention, in a multidisciplinary setting, ensures patient safety and optimizes outcomes. This approach is ethically sound, prioritizing patient well-being and informed consent, and is consistent with regulatory expectations for high-quality vascular care. Incorrect approach is analysis. One incorrect approach would be to proceed directly to a definitive treatment, such as embolization, without a thorough non-invasive imaging characterization of the AVM. This bypasses crucial diagnostic steps, increasing the risk of misidentifying the extent of the malformation, its vascular supply, and drainage patterns, which could lead to incomplete treatment, embolization of unintended vessels, or exacerbation of symptoms. This failure to adhere to diagnostic protocols represents a breach of professional standards and potentially regulatory guidelines for patient care. Another incorrect approach would be to solely rely on the patient's subjective symptoms without objective imaging confirmation and classification. While symptoms are important, they can be nonspecific. Without detailed imaging, the nature and extent of the AVM remain unknown, making any treatment decision speculative and potentially harmful. This approach neglects the fundamental requirement for evidence-based decision-making in vascular interventions and could be considered negligent. A third incorrect approach would be to recommend immediate surgical resection for all suspected AVMs without considering less invasive options or the AVM's specific characteristics. This overlooks the potential for significant morbidity associated with extensive surgery and fails to consider that many AVMs can be managed effectively with less aggressive interventions, or even observation if asymptomatic and low risk. This rigid approach disregards the principle of using the least invasive effective treatment and could lead to unnecessary surgical complications. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a thorough clinical assessment, followed by appropriate diagnostic imaging, e.g., duplex ultrasound, CT angiography, Mr. angiography, to precisely define the vascular malformation. This information should then be discussed within a multidisciplinary team, including vascular surgeons, interventional radiologists, and potentially other specialists, to formulate a personalized management plan. The plan should consider the AVM's classification, e.g., according to the Mulliken-Glowacki classification for vascular anomalies, its location, size, hemodynamic significance, and the patient's symptoms and overall health status. Shared decision-making with the patient, outlining all available options, their risks, benefits, and alternatives, is essential before proceeding with any intervention.